Welcome back, viewers of the award-winning Let's Talk America with host Shayna Thornton. Of course, it's our video edition of our broadcast, and super excited to be with you. And of course, we highlight the best and the brightest issues here on Let's Talk America Radio. Well, tonight's edition of the broadcast is an exciting one. It's also a very educational one. We have a friend of this program back on. It's the one and only board certified and acclaimed plastic surgeon, Dr. Benjamin Stong. Doctor, welcome back to our program.
Thanks for having me.
Okay, so as you know, the world is emerging from COVID-19. We want to catch up on all of our important health topics, and we cannot skip over plastic surgery, cosmetic upkeep. We do not want to, because we get so much feedback and questions from our viewers and listeners about this topic. It is a very hot, trending topic, and today's episode is going to cover that. We're going to cover it briefly. We're not going to be here all day, but we do want to talk about some of the latest trends and just some educational one-on-one on plastic surgery. And I know you're the person for the job. So before we kick off our questioning, I know your CV, your resume, it's super impressive, but give our viewing audience a brief background of you, Dr. Song, and how long you've been doing this, and what's your passion and why do you do it? What's your motivation?
Well, I opened the practice in March 2010. I really just, enjoy the procedures as much as anything. It's fun to give people an improved sense of self-confidence, which is a lot of what we do here. We're not curing cancer necessarily. I used to do a lot more reconstructive type stuff, but we are making people feel better about themselves and feel, look as good as they feel on the inside, so to speak. I'm double board certified in head and neck surgery, ENT, and also facial plastic and reconstructive surgery.
Okay.
And my practice is in Atlanta, Georgia, and Buckhead, Atlanta.
Yeah. Thank you so much for explaining your background, and you're very humble, but I know how many accolades come with you as well. When we think of plastic surgery, clearly we can think of many shows. We see Botched is super popular, the acclaimed television show, reality show that follows the two plastic surgeons around. And we see so many celebrities, high profile celebrities, that often will sort of highlight and brandish the plastic surgery procedures that they get done. Before you and I kick off this important conversation, I do want to ask you, is there a certain patient type, and this may be too vague for you, that may not qualify for plastic surgery? And when I say that, there's so many different surgeries or elective surgeries that people will often get done. And you hear sort of chatter, the doctor's like, well, you're not in the best health to get this. Is that the same for plastic surgery? Do you need to be in overall good health or shape before you consider perhaps a facelift or a butt lift or anything else?
I mean, ideally, I think in general, people who over a lifetime take good care of themselves ultimately are the vast majority of people seeking these types of procedures out. So I don't, it's a chicken and the egg phenomenon, but, I do think that people who generally work out, take good care of themselves, try and eat right, take good care of their skin, are the ones that are seeking the surgical procedures to look better and reverse the signs of aging as much as possible. But, in general, to me, more so than almost their physical health, which of course, again, you want them to be in good physical health to undergo these things. As important as any part of it is their mental health.
Yeah.
And we do try and avoid operating on body dysmorphic patients.
Okay.
No matter how good a result is, they're never going to be satisfied because they don't really see themselves as they are. They see themselves differently than when they're looking in the mirror than the average person. And it's rare, but and then generally I think people with a positive attitude in life, people who are generally well adjusted and happy, tend to sail through these procedures afterwards better than somebody who's not.
Yeah, that's probably true for so many different procedures out there. I recently read, when I was researching and preparing for this interview with you, that as we age, it says that our jawbone actually changes with aging as well. Does that impact what happens to our skin and our face as we get older? Is that, or is that an urban myth?
I mean, not to any significant degree in any short period of time. Yes, all of your bones get smaller as you get older and lose volume and lose lose mineral deposits and such, and so sort of atrophies as well. And so yeah, I mean, over a long period of time, it's sort of like deflating itself. That happens also naturally over a lifetime with loss of fat volume and such. But no, it doesn't really, in my opinion, like cause you to need implants for bone, bone implants. Usually the people who require implants for, bony deficiencies were essentially born that way. They just
Mm.
had, naturally occurring smaller bones that need to be augmented.
Yeah. When people are considering whatever perhaps it's a nose job, perhaps it's a facelift, whatever is going on, how much does genetics play into our fate? I mean, I often hear people say, hey, I look young because my mom looked young, my grandmother looked young. And some people don't quite have the genetics. In your opinion, does that impact it? Or is aging sort of equal opportunist for all of us?
I think it's pretty equal opportunist. I mean, there are certain things that give you an advantage. Darker skin types in general are protected from the sun. The sun's the primary cause of aging in general. And so darker skin types tend to age better than lighter skin types.
Okay.
Certainly people with, better overall genetics, probably heal faster, heal a little better. But you can't beat father time, so to speak. Everybody's going to age, and it is an equal opportunist, and I think sometimes patients put too much stock in the genetic side of it or the genetic component of it. They'll talk about, oh, my mom had this turkey neck. Well, pretty much everybody gets it given a long enough timeline, or the
Okay.
bags under the eyes. They think it's special to their family, but no, it's really just all of us get it enough time.
Yeah, that's fair. That is certainly fair. And of course, humans are living a lot longer than we ever have before. So we're certainly seeing some things happen in our families that perhaps were not noticeable or documented before. When you talked about healing, talk to us right now, because I know we're going to dig a little deeper later, because you certainly treat a diverse patient population. But skin that can keloid, how does that impact their eligibility for surgery in particular face procedures?
Sure. The number of people that actually come into my office telling me that they keloid and that are really true keloid formers is very low. Yes, darker skin types have a greater inclination to keloid formation. Um, in general, what see a lot of times is people were told they formed keloids, and then I ask to look at the scar
Okay.
that they're being told is a keloid. And in general, it's just a bad scar. The keloids don't stop growing. They grow, they grow, they grow. They almost look disfiguring like a tumor, and then you cut them out and they grow back again. It's a very stubborn process, let's say. But most people, from what I can tell, were just told by some other doctor. Maybe they didn't like their work. Maybe they wanted to blame it on the patient, as a factor that they form keloids. But yes, if you are a real keloid former, you shouldn't have, a facelift or
Okay.
whatever. You're going to have a real, potential issue.
Yeah. Tell us right now, obviously, you're a very popular plastic surgeon in the Atlanta area. Of course, you are watching the award winning broadcast, Let's Talk America Radio. We are having an educational conversation with the one and only plastic surgeon, Dr. Benjamin Song. He's breaking everything down. It's an up close conversation, discussion about plastic surgery, what to expect, what to know moving forward, either way, wherever you fall on that spectrum. What are the trends right now? What's popular? I mean, I know you can speak for your patient load, but I see all the celebrities and all the blogs are talking about they're getting lip work done, they're getting cheek work done, they're taking fat from other parts of the body. I'm sure you're very familiar with this, and putting it in other places. So what's the latest right now? What should we be aware of that's trending?
I mean, lip lift surgeries have been immensely popular with COVID and wearing masks. I mean, you can cover up and allow the healing process to go along with virtually nobody else really being able to see anything. In general, the aesthetics procedures are up tremendously overall across the United States, just because people are working from home and have had more social downtime. Some people are required to be on Zoom, but some people can just do all the work from their computers and not really be able to be seen by other people. I don't know if I've noticed any one particular procedure trend immensely, other than maybe the lip lifting,
I see.
some aging face work, just because you can cover the whole lower half
Okay.
third of your face with a mask. But yeah, I mean, just people seeing themselves on Zoom a lot more frequently, or seeing their eye bags and wanting those fixed. Don't like their noses, they can cover their nose up with a mask too. So, obviously rhinoplasty is always a top procedure for facial plastics, and certainly hasn't slowed down either.
Yeah, so much that is going on out there. I'm sure this is a question people are often thinking of when we think of facelifts. I don't need to tell you that there have been some very bad, disturbing examples over the years that pop culture has seen and taken advantage of. One, just plastic surgery 101. What exactly happens with a facelift, Dr. Song? And I know it's hard for you, and I'm sure as a great board certified plastic surgeon, you're not going to criticize one of your colleagues' work. But again, pop culture, we've seen some really bad examples of it. If you can answer this, how does one that has gone to school, that's been an expert in this, I guess many people want to know, get to the point where you see what's been done on some high profile celebrities and you're thinking, no one stopped this person. How do we get there?
I often say to people, just because you have celebrity and money doesn't mean you make good decisions.
Good.
And oftentimes, you see it frequently. People make associations that shouldn't necessarily have an association. So I've had people who come to me for a revision facelift, and they're like, "Well, I went to this guy and he did my friend's breast augmentation, and so I went to him for my facelift." And they just sort of assumed that because somebody was good at breast augmentation, that they do facelifts, and that's oftentimes not true. There's a reason that facial plastic surgery is a specialty in and of itself, and it doesn't mean people who are board certified in sort of general plastic surgery can't be good at those procedures, but you need to make sure that these people are doing those procedures all
Yeah,
the time. That's all I do, facial work.
yeah,
Now, what does a facelift mean? A facelift is generally a cheek and a neck lift.
I see.
And the deep plane facelift lifts the upper cheek, whereas everything else only lifts the lower cheek and jawline. I mean, the deep plane facelift also does the lower cheek and
Okay.
jawline, but the distinguishing hallmark is a lift of the upper cheek, and it's a more comprehensive and complete rejuvenation to the face. Actually, if that's something that's really trending, that is really trending,
Yeah.
deep plane facelift surgery, but only a few of us across the world actually do it. A lot of people say they do it, or maybe market or advertise that they do it, but there's not really truth in advertising laws that
Right.
prevent them from saying these
Never.
things. And so, I end up getting a lot of people who coming to me who have actually done all the research, researched what I do, how I trained, who I trained with, what my credentials are,
Okay.
and you sort of checking all those boxes, and then ultimately they like the pictures, and you can't talk your way around pictures. If the pictures don't look good, it's not all of a sudden miraculously going to come out different for you. And
Yeah.
so that's ultimately where it rests.
Yeah. What's the recovery time for the procedure?
uh for facelifts, I mean, I talk about sort of acute and chronic recovery, or long-term recovery.
Okay.
Acutely, your stitches are out within 10 days. So, it's maybe 10 to 14 days, but you're still going to have some bruising and swelling. I generally tell people don't have some major life event planned for at least a month.
Okay.
Nothing where you're expected to be ready for wedding photos, or, kids' college graduation, or any, such thing. And then I talk about when I actually take my photos. Usually I'm ready to take facelift before and after photos somewhere between 3 and 6 months.
Okay.
The commitment is there. There's a more of a long-term commitment. but the benefits over a lifetime are, innumerable.
Yeah. For something such as a facelift or any procedure, but specifically facelift, are there things after surgery, and I'm talking about once they heal, 6, 7 months later, okay, that does not necessarily enhance the work you or another qualified surgeon has done? I mean, and I often think of that because, when we think of the very popular weight loss procedures, of course, I've seen the news reports where people have sort of dive back into old habits and it sort of reversed everything that was done. When it comes to facelifts or any other procedure in
Mhm.
cosmetics, is that possible? Is there excessive drinking or smoking or a certain lifestyle of partying all the time and not getting rest? Would that sort of defeat what you did?
I mean, yeah, I mean, that goes into the whole nutritional environmental side of, like, yeah, somebody who takes good care of themselves, again, is going to do better in general. If you're going to lose a significant amount of weight,
Yeah.
more than 30 pounds in particular, you'd probably want to wait on having your facelift. But
Okay.
even then, that the experts in facelifts are going to look at you and know, I mean, either you have a lot of fat there, then you might lose it, or if you don't, and it's just mainly body weight, that's a determination you'll make with your surgeon. I think, after the procedure is over, I think the one thing that, a lot of clients, and even the physicians don't go over with their clients, is no matter how great your surgery is, it doesn't change the quality of your skin. And so your skin is going to still have a similar quality that it did before surgery. And if you're not working on the skin quality,
I see.
your skin is going to drive the recurrence of the aging process to a certain degree as well. And so, um, in particular, from aging face surgery, the elasticity of your skin is very important, right? So people with poor skin elasticity, their skin's going to stretch back faster than somebody
Okay.
who has great elasticity. And, to a certain degree, I used to try and say, oh, it's really about the lifting technique. And while that is true, if you can get better elasticity after your facelift,
Okay.
then it's only going to improve the result, maybe make the result last a little longer than it otherwise would have. And really, what I talk to clients about is doing radio frequency energy, if they're willing to do it. And I give them a discount if they're my facelift clients off of it. But that's really the technology that improves skin elasticity without surgery. Even if you have that as a primary procedure, that it creates elastin and skin elasticity. And I think that is also one of the hotter trending procedures on in the market is skin tightening procedures. And if you can get that after your facelift, is, 6, 7, I usually talk about 3, 4 months afterwards if they want to do it then. That'll improve the actual skin quality, which, no matter what you do, a facelift doesn't change the skin quality really.
I see. Thank you for being transparent with that. Listeners and viewers, you are watching the one and only award-winning broadcast, Let's Talk America, with host Shayna Thornton. Of course, I am Shayna, on-air host and executive producer. We're on this episode beginning to wrap up what we're speaking with a one-on-one exclusive interview with plastic surgeon Dr. Benjamin Song, and we are talking about facelifts and healing process. And he's being transparent and open about what it takes, that patients have to do their part as well. I've got to ask this question because it's real talk for real people, of course. Want a balanced conversation. So many times I've heard people say that, well, if you get one facelift over time, gravity will still hit because, as you said yourself, and not necessarily about this topic, but we all will age, right? As long as we're alive. So, God willing, that's there. But if I get one facelift, and just speaking hypothetically, someone 10 or 15 years later, Dr. Strong, will they be back in your office because of gravity?
Oh yeah. I mean, when a facelift is done the right way, no matter what, you're probably going to be ready for one another about 8 to 10 years if you care enough, right? Like, ultimately, it's how much people want to manicure their looks over time. And so, and it doesn't mean necessarily that you're going to look odd or fake or unnatural if you have more than one facelift. It's really about going to the surgeons who do the procedure the right way, pull the skin in the correct directions, use the correct types of muscle techniques, use the correct types of incisions, so that you conceal everything as much as possible and it just looks natural.
Yeah. And
Um,
I'm glad you brought up the N word of natural because I think so many times when we look at celebrities or high profile individuals, and certainly not to make light of it, but you'll see some of them, and I'm sure you have as well as a plastic surgeon, they're almost unrecognizable sometimes. And I would think, and I guess everybody has a different, motivation in it. But when you're not recognizable, and it's not like, well, they look so much younger. Sometimes I've seen people struggle to even recognize who they are. I think that's one of the ones where you say, was that successful? Because I'm not recognizing the individual.
well, I mean, I think that segues back into the mental health component to all of this. And, first, the person should be doing it for the right reasons. I think sometimes we pick on celebrities maybe a little bit too much, fairly or unfairly. They happen to be in the news more frequently
Yes,
than the rest of us.
absolutely.
But I think what people sometimes discount is the amount of care that goes into keeping them looking young a lot of times.
Good point.
Look at how great Gwyneth Paltrow is. I have no idea what she really has or has not done, and I'm not gonna comment on that, but
Yeah.
her skin looks great, and I doubt it's only from bee venom treatments. A lot of times I don't think people realize, there a lot of people, maybe not celebrities, just people with good skin, are going weekly and to the spa to get a microneedling or a chemical peel or
Yes. Good point.
some sort of procedure. Um, you can't just do it once every 5 years and then expect there to be some miraculous results. Surgery is a miraculous result for the most part,
Yeah.
and that can be done once every so often.
Yeah.
But taking good care of your skin with skincare and minor procedures consistently over time is going to pay off, over long periods of time. It's
Yeah.
not, there's no short, quick fix, but, they're not talking about their
Correct.
weekly appointment with their
That's true.
esthetician or the doctor or whatever, or they're getting their CO2 resurfacing once every other year or once a year, and their skin tightening once a year. I would just say, as far as people just not looking like themselves, going too far, either they're probably trusting the wrong person to do the procedures, or they are getting, just they have some sort of body dysmorphic component to what's going on.
Such a great point. And I also will mention Halle Berry, who looks amazing
Mhm.
in her 50s, right? And I say that, bring her up, or Gwyneth Paltrow, and there are many others out there. But you're right. I mean, we focus on plastic surgery, and some have been more transparent than others. But you're so right. We don't know what sort of weekly maintenance is put in it.
Mhm.
Obviously, because we see at the Oscars, it takes hours to get ready. So that doesn't happen by chance. So that's a valid
Mhm.
point. And for anyone watching us or watching any of the shows, to just keep that in mind, that there are other things that may go into it that the celebrities have access to that may not necessarily be shared. You brought up the T word of trust, and I think that's a great point to really conclude our conversation on this episode of Let's Talk America Radio on Dr. Stong. So many people throw around the word cosmetic upkeep, plastic surgery. I'm going to do this. You see it, all the celebrities. And sometimes you do hear stories of people not going to qualified medical professionals, right? There's someone that sort of sets up shop. I'm assuming in some jurisdictions, these are legal to do, depending on how they market themselves publicly on what they're doing. And obviously, you're board certified. Obviously, you've gone to medical school. Obviously, you have the resume and CV to back it up. But how important and critical is it when we are talking about going under the knife, any medical procedure, to make sure that we're vetting that medical professional, or professional, if that person's not claiming they're medical or
Mhm.
not, before you entrust them? Because I will say this, as a professional and as a person in the world, not as educated on cosmetic surgery as you, but it's something that should be taken seriously. And we should not just assume, well, they're fine if they have a shop, if they have an office, they're qualified. How critical is it to make sure you know who you're being with and who you're being cared for?
Yeah, I mean, I think it's the number one most important thing. I mean, I don't think you can have a more important thing to really vet from a patient perspective, even with similar board certifications. So let's say the surgeons that you're considering or the doctors you're considering for a procedure have all the same board certifications even.
Mhm.
So you've sort of established this baseline of credibility. um, there's wide variation in outcomes from those same doctors. And so, I think finding the person with the right reputation is extremely important. I mean, even in a city the size of Atlanta, where I happen to live and practice, there aren't too many people that I would send my sister to, for rhinoplasty or
Sure.
facelifts.
That
And
says
I
a
think,
lot.
but I also think that there's a misconception that like Beverly Hills or LA or Manhattan happens to have better surgeons.
Yeah.
I don't necessarily think that's true either. They
Mm.
happen to have a higher concentration of surgeons. And because you have a higher concentration, maybe there's, by default, a few more reputable guys or guys doing good work. But just because you park yourself in Beverly Hills or Manhattan,
Yes.
I don't know how you could stay in business for very long if you're not very good, because the prices are astronomical to be in
Okay.
practice there. But and like I said, just because you have money or fame or celebrity doesn't mean you choose the right surgeons.
Good point.
And quite frankly, sometimes I think some of the celebrities and people with money, think that because the person is in Beverly Hills or in Manhattan, that they might be better.
Okay.
And that's certainly not true. There's a lot of smoke and mirrors that I see on social media, or I just know in the background of what's going on in those areas. And so you really need to look for somebody who does the procedure a lot that you're looking to
Good
go
point.
to.
Yeah, such a good point to highlight that again, as you just said, that whatever you're looking for, it's facelift, it's a nose job, any sort of augmentation that's not on the face, to make sure it's someone that's specializing in that. And I will make the comparison. It's like going to a cardiologist or a nephrologist or a neurologist. You're looking for a specialist, even within the whole medical world, to make sure it's somebody that's specialized and trained and familiar with whatever you're requesting. And I don't think, and I hope this isn't happening, that that's sort of dismissed in a sense because it's elective procedures or surgery, where people sort of group it all together, where I'm fine. And if he or she wasn't qualified, they wouldn't be able to practice. And I do certainly have trust in the medical system here in the United States. But I think it's always helpful, even if you're talking about a cardiologist or neurologist or ophthalmologist, to do your research, right? I'm sure you would agree to that as a physician, to always do that, because after all, it's your body, right? I mean, no one can speak up for your body and your decisions like you, right, Dr. Stone? Do you agree?
Yeah, I mean, I think sometimes there's a component of price shopping that goes into this stuff.
Mm.
Um, I think that's unfortunate. Maybe there's a sense of, well, anybody should be able to do these things, and I don't know if that's necessarily true. I mean, there's a certain amount of sweat equity that goes into it from the surgeon's side of things, and there's certain value to that sweat equity. And if you're getting a nose job or a facelift for bargain basement prices, you might want to ask yourself why.
Yes. Yeah.
Why is this so much cheaper than every other guy in town? Or or why in reverse, like we often get it. I mean, I'm not the same pricing as LA or New York, but I am on the higher end for Atlanta for pretty much all the procedures that we do. And we do get some, I think it's from people who maybe haven't done the research that they
Mhm.
need to have done. But we do get, oh, well, why is he the most expensive? That's more expensive than the other guys that I've called. Click and they hang up, and that's fine. You're welcome to question or judge what we charge, and you don't have to use us. But you might want to ask yourself, well, why is he the more expensive option
Yeah.
between the options that I'm choosing, and not just think, oh, I can find a better deal, because bargain basement facelifts don't usually end up very well.
Yeah. Well, real talk for real people, always vetting and having a balanced conversation. Before you leave us, I know this is an obvious answer for you, but for those that are novices in terms of cosmetic upkeep or plastic surgery, so insurance, I'm assuming, don't cover a majority of plastic surgery
None.
procedures. Oh, okay.
Yeah, no cosmetics. I mean, because insurance is there for medical necessity. Sometimes I do have to. My favorite word is need. When people come and interview with us and they say, "Well, what do I need?" or "What else do I need?" or I say, "Well, you don't need any of this. This is not a need. This is a want." And I think that's another thing is I think there's a blur around these procedures. Just like you don't need to go to the most expensive haircut highlight place. It's a want, and this is no different than every other want out there. But again, I think it's very common for people to look at it from a, hey, I need this. And no, you're not going to live a shorter lifespan because you don't have a facelift or a rhinoplasty. And same with eyelids or any of this stuff. So yeah, insurance doesn't cover any of it, and that's why sometimes I think, well, maybe this isn't for everybody looking for these procedures. So
Such a great point. I always love to have you on, Dr. Stone. You always keep it real and authentic, and that's why you are highly sought after here as a guest on Let's Talk America Radio and other programs. Before you leave us, share with our viewers and listeners where they can go for more information on you. I know you are a published author as well. You write for several publications, always educating the general public about plastic surgery, some of the do's and don'ts.
yes, exactly. So you can find out more about me. My practice is called Kalos, KALOS, plasticsurgery.com. Our office number is 404-963-6665. And we only do virtual consults, even going forward, just due to the high demand of our practice. We no longer see in-office consultations. If we need to bring something in to assess for revision purposes, why they're getting it done or what was done previously, I will. But we do everything virtually to simplify things for the clients and our practice.
And that's convenient for all. Thank you, Dr. Song, for being here on Let's Talk America Radio. We certainly appreciate your time and efforts. For those that are watching us, stay tuned in. Let's Talk America Radio offers real talk for real people. Your award-winning news program is here for you, and we will continue to report and highlight and interview the best and the brightest on a variety of topics. For more information on the program, visit ltaradio.com. That's ltaradio.com, or follow our hashtag on social media at LTA Radio. Stay connected and take care. Thanks, Dr. Song.
Thanks, Shana. Have a great day.
Thank you. Stay informed, everyone.
All right. Bye.